We are delighted to have Assemblymember Mia Bonta with us. And before we dig in, just want to say a couple words about the event this afternoon. And there's going to be a reception afterwards, so it's not over after this. But a few words, reflections. And before I forget, the secretary reminded me New Mexico has a universal child care brief. If you Google New Mexico universal child care brief, it pops up. It's 11 pages. I was skim reading it during the last session. It is great, strongly recommended. So, I'm not a child care expert. I came to this issue because I care deeply about the affordability crisis that families in this state and country are experiencing. And I knew from the data, from conversations, that childcare is a core part of it, and felt like we were at an inflection point with the action happening at the state and in our cities in terms of accelerating that effort. So wanted to bring folks together. And two reflections on what I've learned today. One is that all of the work in this space stacks on top of each other. Right? The stories in New Mexico and in San Francisco, each step becomes a platform for the next set of actions. Each study becomes a platform for policy, which means even if you're taking a small step, you're unlocking opportunities for people who are going to take the next step, and that's really powerful. The second thing I learned, and maybe I shouldn't have been surprised, is this is an awesome community. And I'm not going to disparage other policy communities, but this has been my favorite. It seems like even when folks come from different coasts, from different backgrounds in terms of research and policy, it's clear that everybody's on the same team. They're sharing their best practices, they're sharing their experience. That is awesome, and I hope some of the connections that you made today persist. So, with that said, delighted to have you here, Assembly member. So Mia Bonta represents California's 18th Assembly District, encompassing Oakland, Emeryville, and Alameda. She's done this since 2021. She serves as chair of the Assembly Health Committee and is the founding chair of the California Legislative Children's Caucus. She, has a long and impressive career. Prior to her election to the State Assembly, she was CEO of Oakland Promise, a cradle to college and career readiness initiative serving Oakland public schools. From 2018 to 2021, she served as board president of the Alameda Unified School District. She is a longtime champion of families, of children, and of a more affordable, more equitable California. So thank you so much for joining us today. And I'll let you start with some remarks.
Thank you, Neale.
Well, I'm going to stick to the podium for a minute, and then we'll happily head over there to answer some questions. I want to thank you all for coming together. As Neale said, I'm Assemblymember Bonta, and I never start any talk without saying I get to represent the beautiful people of Oakland, Alameda, and Emeryville in the 18th District of California. And it's really a genuine privilege to be with you all today. I was asked by the Speaker of the Assembly to come join you here today. And I said, well, I'm going to come, but I want to come to hear the whole thing because you all are speaking my love language, really around early care and policy. And it's so incredibly important that we weave together not only incredible research and data from all aspects, and use the economic lens, the language of economy to be able to do that, but then also weave that together with policy and practice. So it's wonderful to be here with you today. So I came to this work like a lot of people because I cared most about in the world the combination of understanding my own lived experience as a child who, by fiat of, a teacher mistaking me for my classmate, and being able to go from my school, where I was raised by a single mother, to very competitive higher education institutions, and got to walk across the stage with a 6-month-old in my hands in law school from Yale Law School. But also because of the professional frustration of making a decision when I was 13 years old to work on behalf of children who are like me and who came from the experience that I did. Most recently, before coming to the legislature, as Neale mentioned, I worked at the Oakland Promise. I see Bay Area Council in the House and First Five in the House, and so many others who really helped to make that cradle to career model come to life in the city of Oakland. And before that, I had done a lot of work around ensuring that our brilliant babies had the opportunity to go to college and graduate, and then go on to just be their wonderful selves. And it has been my work. And I came to the legislature and understood very quickly a couple of things. One is that the state was spending enormous sums of money on children and families. And last year, 25-26 budget alone, for instance, we spent $14.4 billion in child care and early learning. And we are the world's fourth largest economy. But we're still falling short for our children. 19% of our children in California live in poverty. 600,000 children here do not have adequate and quality child care. And we know that there's a persistent opportunity gap that we just can't seem to get rid of. We know that that happens as early as being able to establish kinder readiness, or the lack of kinder readiness, and that there are disparities around that. And we see that repeated again in fourth grade academic outcome results and beyond. So we know that we have some persistent thing that keeps us from being able to make a difference and a change. And we also know that we have the ability to change what that looks like. We are just down the street from here, the source of the AI industry, the source of innovation, the source for the world of so much that is right and good. And we know what small t technological innovation needs to look like. And it was one of the reasons that I wanted to go deeply into this area around childcare and childhood outcomes in the state of California. I started to listen to a lot of stories. One story from a provider really touched me, one from Tuolumne County, who walked us through her monthly budget line by line as a provider. She's serving 14 children in her care, and her monthly income is $12,276. But her monthly expenses are $12,082. She is all but left with $194 every single month, and that's a good month for her. She works weekends teaching CPR classes to be able to close the gap, and she does it because she loves what she does. She loves taking care of children, and she loves serving families. That's our child care market as it stands right now: fragile, underpaid, unappreciated. And the operating margins we know are so incredibly small that it keeps our providers from being able to do anything but stay up at night crunching the terrible numbers of how they are going to be able to persist and exist in the following day. And then if we move to the demand side, our children and our families, California in 2023, child care for one child averaged about $11,900. For a single parent earning the median income of $45,000, infant care consumes half of their income. And that's the median. In our rural and agricultural counties, it's even worse. Here in the Bay Area, it's far worse than that. The market, left to our own devices, is simply not cutting it. But the reality is that governments and policy, left to our own devices, if the last 25 years shows us anything, is also not cutting it. And we know that that's an incredible challenge that we need to solve. So here is where Daniel, who's with me, my staffer, starts to get very panicky because I start to go off script, and everything that I've written from here is really in large response from being able to have the privilege of being with you all for several hours. So what do we do? What do we do through public policy, through budget, through oversight? That's what I think about as a legislator. And how do we ensure that through those functions, we are starting to shape the marketplace in a different way? And we are starting to shape the difference and the change in the dynamics of supply and demand in this space of childcare. So we heard a little bit. We heard one thing, or I actually read something because I also was rescanning the policy papers that were written. We heard that infant and toddler care, if we wanted to fully fund that in the state of California for those who are low and middle income, it would cost us $4 billion to $8 billion annually. And if we were really, really bold and provided universal care, it would be $12 billion to $21 billion annually. Now, I'm going to posit, and this is going to be a very unpopular thought for many of you all, even if we spent that money, it would not lead to the kind of child outcomes that our children deserve. Because we are not placing the right conditions of readiness in order for us to be able to adequately and effectively spend those invested dollars. So here's where the policymakers come in. What can we do, and what should we be doing collectively? The first is elect more women. I heard that. And I say that because I see Sulema in the background there, in the back there, and Kelsey, and so many of our people who are with us today from our state offices. Sulema in particular is from our Women's Caucus, a consultant there. The Women's Caucus in the California State Legislature is the strongest it has ever been. We are the reason why we have had such a focus on childcare in the state of California. And it is because we are women who raise children, multitask, and know how to get things done. So I want to honor and thank our current California Legislative Women's Caucus Chair, Cecilia Aguirre-Curry, in being able to create that environment for us and carrying that mantle forward. I think the next thing that we absolutely need to do is to change our mindset. Now, if we were really being honest with each other, we would recognize that the reason why we're not funding childcare fully, and the reason why there are multiples upon multiples of regulations and funding streams, is because of two things. One is because we are still living in a world where many people believe that women belong in the home and they do not belong in the workplace. That is the reality, and we live with that legacy every single day. And secondly, we societally still blame poor people for being poor. And because of the dynamics of those two unspoken but very true realities, we develop a complexity around how we behave and how we respond to the market, how we respond to making sure that we are incentivizing, or quite frankly, disincentivizing women from entering the workplace. And that is something that we have a mindset change that we need to really take responsibility for in our policy making. So I don't know what that will result in terms of my policies going forward, but I want us all to hold that truth. The second is, the third thing that I will say is that we need to absolutely push for integrated governance and oversight. I said to the secretary as she was passing by, I want to move to New Mexico. Because New Mexico has been able to do something that we in the state of California have still not done, which is prioritize and elevate an integrated approach to creating positive outcomes for children. And I say that with all due love and respect for the incredible agencies that I get to work with every single day. We are still, in order to be able to ensure positive child outcomes, having to crosswalk between the Department of Public Health, CDSS, CDE, OSHA. I'm sure you all can name a lot more. And that's just the tip of the iceberg. So if we really wanted to be able to, from a policy-making standpoint and an implementation standpoint, we have to completely reshape the way in which we govern and in the way in which we create policies. We have to make sure that we're creating communities of practice amongst the experts and the staff who are with us for, decades, who are so profoundly effective in what they know about what needs to happen in California. We need to make sure that legislators are organized in a way around policy in our policymaking function to be able to have cross-sector policymaking happening. I sit on health committee. I also sit on education committee. I also sit in public safety, or have in previous years. And I see a bill go from one committee to the next. And I have 3 different conversations about one piece of legislation to move forward opportunity for children. I think that needs to change. And finally, we also need to do that in terms of creating an integrated mindset and an integrated network of individuals supporting our children in our agencies. We need to make sure that we're connecting those silos. And finally, I will say that probably the most important, and hopefully if you didn't find my money's not enough too controversial idea, is that we need to absolutely streamline our financing of childcare and early learning, both from the funding and financing of it, but also from the regulatory regime that comes out of the financing that we provide. A couple things that we need to do. We need to think beyond the budget year. We are stuck. We only care about the fiscal pressure to the general fund year by year by year. Well, I have news for you. Children don't just exist in one year. So that is work that we need to do. How in the world we might be able to do that, I don't know, but I know it needs to be done. We need to ensure that we get rid of this layered financing that's happening. I talked to Kristen Spanos for a brief moment from First 5 Alameda County, and she mentioned 36 different funding streams in order to be able to support the work of First 5. And then speaking of that, we, through Prop 10 in the state of California, have basically funded our child care on what we knew and hoped would actually be a declining revenue source, right? We taxed tobacco, and then people did a smart thing. They stopped smoking. So now we are in a position where we don't have the revenue source that we need, but we know that we need to have stable, ongoing, consistent funding that the market can depend on in order to be able to implement all of those changes. And my last thing on this will be that I want to make sure that we have trust fund babies in the state of California, like New Mexico has trust fund babies. Because if we were to be able to create that ongoing source of revenue, that thoughtful source of revenue that would double and that would be dedicated towards our children, then we would have enough money to be able to fund in the way that we need to. So I will stop with there. Those are my thoughts on this Friday. Is it Friday? Thursday. Sorry, Thursday afternoon. It's been a long week, and would love to just engage in some conversation further. Thank you.
Thank you for the remarks. I'll start with a few questions, but then really just want to open it up to the audience and let them ask about what they're interested in. And because you covered so much ground, I'm realizing you've already touched on some of my questions, but I'll maybe put a slightly different spin on them. So when I was in the White House, a cabinet member asked me the following question: how can childcare both be unaffordable and there can be a 1-year waiting list to get a slot? And we've talked a lot about affordability, but we haven't spent as much time talking about, I think, another real concern families face is that they're just not going to have a slot in a nearby facility of the type that they're looking for. How do you think about that constraint in the system and how to address it?
Well, I think the constraint in California is largely due to our short-sightedness. We have been able to do something incredible in the state of California, which is to offer essentially universal pre-K, or in our parlance, TK, for our 4-year-olds. We did not really factor in or plan for the incredible destabilization that would have to our mixed delivery system for our birth to 3-year-olds and 4-year-olds. So as we were all fighting for transitional kindergarten, we really created a situation where we didn't have visibility into who needs childcare on their own terms, back to my comment about behavioral economics, right? We all want to make our own choices about childcare, and where is that available? And what is going to be funded and what's not? So it leaves us with a highly variable sense of saturation in some areas for different types of childcare, and incredible scarcity in others. And so as we move towards universal for a group, because the next step that we need to focus on is building out our mixed delivery system, or I should say rebuilding our mixed delivery system in a thoughtful way, we are going to be pressed. I had a bill, AB 51. People must have thought I was crazy. I was just coming off of the outside world of not being in Sacramento, and I ran a charrette session for providers. I said, we are going to do policy from a user-centered approach. And so we put up faces of the mom of the 2 and a 4-year-old, the family care provider who would be struggling with the system right now. And the objective of that was to get all of the stakeholders who all had their own investments in TK and in their own particular agenda to be able to come together to say, how might we do something differently? Boy, did I run into a blade on that one. AB 51 exists. It's a step in the right direction, but it is a far cry from being able to really ensure that we have a strong and healthy mixed delivery system. So I think that's, for the state of California, where our cutting edge and our leading edge is next.
Let me ask one question on something you touched on in your comments and came up earlier in the day, which is the plethora of funding streams and the complications that creates for families and providers. I think my experience with government programs is that it's hard to integrate them because different stakeholders have vested interests in the different funding streams, the different institutions. Is there a roadmap? Sort of what gives you confidence in being able to go on this journey?
That we are in a fight or flight moment right now. I always look for silver linings because I try to be an optimistic person. The only gift of HR 1 is the incredible destabilization for California that HR 1 has caused. We were first gifted with COVID-19.
Can you tell the non-California?
Oh, sorry. We were first gifted with, well, it's actually federal, but we were first gifted with the pandemic, and then through HR 1, we have a massive shift in federal policy around social benefit programs, and particularly around food, care, our care economy, and healthcare. And I think what is happening as a result of that is that every state level, county level, city level actor is going to be faced with the fact that we are going to have to do more with less minus zero. And I think that destabilizing function is causing people to make sure to get back into the same rooms that they were in during COVID-19 to say, how in the world are we going to make this happen? And so I think it's possible that part of the roadmap could just be never letting a good crisis go to waste. And surely we have one now. So the first is making sure that those people and stakeholders are coming together in those rooms, and then making sure that in the state that we are far more responsive to the moment through our policymaking and our budget in the next 2 to 4 years.
Great. I'll ask one more question and then open things up. For people who are outsiders to early childhood education and then the TK to kindergarten system, how do you explain, how do we think about the fact that we have this mixed delivery system, through 3 and 4-year-olds, and then we switch to a single public system? How do you get these things to work together? What's the underlying philosophy of how you line them up?
That's a tough question. I don't know that there was an underlining philosophy or how you line them up, which is, I think, why we are in the jam that we are in right now. I think going forward, the philosophy that we should all be organized around is what I hold most dear, which is just a cradle-to-career, place-based mindset. I have several pieces of legislation myself, AB 1996 and AB 1969, that are moving through the legislature right now with the intention of making sure that we are doing a better job of organizing our systems around a child and what that child needs at various stages in their life, instead of doing what we're doing right now, which is trying to figure out how children and families should be organized around the systems and the kind of the legacy systems that we've created. So hopefully we will be heading in the right direction with that kind of roadmap and many other pieces of legislation that are moving through this year.
Fantastic. Let me open things up for questions. I think we have mic runners per usual. See, there's a couple in the back. Again, maybe introduce yourself.
Oh, so sorry.
Thank you, Mia. Thank you for the shout out first. Much appreciated. Matt Regan with the Bay Area Council. I don't know if this is a comment or a question, but I want to maybe riff on what you were saying about the bureaucracy that's strangling the provider community in particular. Way back in the dawn of history, when I took my daughter to her family-based childcare provider every day, she knew I was a first 5 commissioner. She knew I worked in the policy area, and the first 10 minutes on the doorstep was, "Can you stop it with all the paperwork?" I'm like, I have a business to run, I have kids to take care of, and I spend half my day filling in forms.
Right.
So that runs. I mean, this is probably most true for California, but maybe in other states as well. We've become a state of box checkers. That the process seems to be more important than the product. Making sure that we've satisfied every little box that needs to be filled in. How do we get past that? How do we make the product more important than the process?
Yeah. And I want to thank you, Matt, and the Bay Area Council. I think we've been very fortunate in the Bay Area to have a business community that for decades really has been leading in the space of early childhood childcare, and we've all benefited from that in the state of California. I think at the heart of why we fill out all those check boxes is compliance, and it's this compliance mindset. So at some point, I think one of the things that we need to do is streamline all of those efforts. If we could have the 14 funding streams be collected, at least the ones that State of California can exclusively control, and we can make sure to do that not only across childcare, but to do that within our healthcare system and housing, and again, organize the systems around the end user, then we're going to be better off. What is that going to take? It's going to take every single one of our agencies, at least at the state level, for our part of that, to come together to make some calls and say, you know what, we're going to figure out how to be able to have integrated data systems. We have eSIDS, we have Cradle to Career database. We have things that are moving along right now that could be the building blocks for how we get you to have to check one less box as you're trying to get childcare for your child. I think that is definitely the space where the state can play a significant role. And it's going to require us to have innovators in our state systems that are willing to do that. We move away from legacy systems all the time in technology and software. We have not been able to do that in childcare, but the moment certainly calls for it right now.
I'll just jump in from sort of a cross-cutting perspective. I've examined housing policy at the federal and the state level. We had Jen Palka come here and talk about the California unemployment insurance system. Right? These issues exist across many domains, but there's also an effort to tackle them. And so I think you sit across multiple committees. We may be seeing a movement afoot to address these, to come up with best practices that can work across different important services. So I don't want to be too optimistic here, but there's at least cross-cutting recognition of the issue.
Absolutely. I think Jen's work is really pushing us into the space of making sure that that our public interface is coming into the 21st century. And I quite frankly also
think... It's only 2026.
I know, only. We're almost... Yeah, and I also quite frankly think that, that the aspects of AI that are incredibly good and important are going to be able to serve us very well. And we know that there are kind of privacy issues and one-stop issues that we need to tackle along the way, but I think we're up for the challenge in California.
Maybe here and then there.
Hi, Anna Powell, Center for the Study of Child Care Employment, Berkeley. I'm reflecting on the way in which state sets some of the parameters, sets some of the funding, and then a lot actually takes place at the county level. But with our 58 counties in California, they are incredibly different sizes, capacities, et cetera. So this sort of creates like a have and have-nots in terms of counties that are able to do a lot, even before passing a landmark ballot measure. But having this county orientation of actually the governance, the implementation of the dollars, what could we do in order to break out of that? Because I know like a county like Solano, they tried to pass a ballot measure 10 years ago and it failed. And as a consequence, they subsist on the shoestring budget that comes down from the state. So it seems to me that there has to be some kind of tinkering with that, but all of our systems are predicated on county this, county this, county this. Mm-hmm. So do you think there's a capacity for the state to tinker with that county structure?
Oh, I sure hope so. I'm working on, one of the pieces of legislation that I mentioned, AB 1969, is predicated on building out a cradle-to-career model using collective action, collective backbone agencies to be able to support regional work that's place-based and cradle-to-career. And counties, all counties are not situated to be able to maximize the investments that hopefully the state will make in that area. So I think one of the things that I've seen happen that's been very good is that we are starting, at least in the education space, we are starting to rethink with our master plan and other kind of aspects which county is best situated and has the best expertise to be able to support not only that county's work, but the entirety of the states. And so I think that there's flexibility built into, at least on the education side, the TK-12 education side, to support that. So I hope I see more of that. And I think it's going to take a very brave chief of staff to our governor, this one and the future, to be able to help us do that. And I just also want to give a shout out to incredible Secretary Johnson, Kim Johnson, in right now has a lot on her plate, and I think also has incredible insight into how we can make sure that the state to locality connectivity is much stronger, and where appropriate can kind of bypass the county effort or allow counties to be able to amalgamate so that they can pull their resources together.
Was it Abby over there?
Hi, my name is Abby Sanchez. I'm a pre-doc for Neale. I'm an East Bay native. I'm really, really interested in what you're speaking to the next steps may be. Earlier in the conversation with the San Francisco team, they were talking about zoning and building as like a major obstacle. You mentioned having a mixed delivery system, maybe that's given different preferences on the East Bay rather than SF. I'm interested, what does it look like to prioritize a mixed delivery system? Are you thinking of home-based care subsidies, maybe informal care subsidies? What are like maybe some policies that are going back and forth?
I mean, I think we're working on some of those right now. And I just want to give a shout out to the Jenkins and Lands for their 0 to 3 policy brief, which I thank you. Thank you. I think we're doing a couple of things right now. One is that we are tackling the trying to push for rate reform. We have been for several years. I think we have a time clock now associated with that. We have moved towards looking at total cost of care, which will enable us to really be able to ensure that every type of child care provider has the resources that they need. And quite frankly, on that issue, we are going to need to be courageous and bold as policymakers, because we are creating a 2-tiered system where our state preschools and state providers have resources and are able to tap into the various funding streams and reimbursement rates that are able to keep them a little bit better situated. But let's be real, not really. But we are not creating the same kind of opportunity for our family child care providers and our non-center based providers as well. And I think that's the work that we need to do. It's going to require a lot of bravery and collaboration across the legislature with a lot of different stakeholders.
Here in the back.
Hi, I'm Austin Land at UC Berkeley. Thanks for the shout out. AB 51 you mentioned. I think it was amended 8 times. It had so many, 9 times maybe. Great ideas that reflected like just no nonsense, clear, like let's make this easier for everybody. And as you mentioned, it sort of didn't maybe carry along everything you would have hoped. I guess I'm wondering, in all of the conversation about the fragmented funding streams and the constituencies that build up around these funding streams, and is that an obstacle to advancing some of these streamlining system reforms that you can see and propose? And if so, what's the sort of deep structural change that puts us in a position to scale?
Thank you for watching the 8 different versions of that bill. I think it's going to require a group of legislators coming together and having a lot more heft and connectivity. It's going to require us to be able to pull in the various agencies and the various stakeholders to be able to make sure that everybody feels like they are getting their fair share. And quite frankly, I think we have to move into a space of beyond scarcity. So where I very much appreciated the conversations around abundance, I think that definitely lends itself into this place. We wouldn't have had 8 different versions of AB 51 and we will be able to contemplate more of a fair mixed delivery system if we are doing the baseline of raising up the value of childcare providers, right? So we are living in a scarcity mindset right now. So maybe in that area, a big funding boost would help that conversation go a long way, as it did when we decided to raise the minimum wage for healthcare providers to $25, for instance. That would be a step in the right direction. And I think it would cause people to feel and experience enough relief that they could move from a mindset of scarcity to a mindset of collaboration. And we are all working together to be able to do that. I'd love your help in that, as well as you, Dr. Landers.
Here in the front.
Hi, Laura Pryor with the California Budget and Policy Center. Thank you so much for joining us. And I want to ask a question about your comment about the trust fund babies.
Yeah.
And I think it's fair to say in California there is certainly a political will issue with raising revenue. And I'm curious your thoughts on the role of research in helping to make the case for raising revenue for children.
Well, and this is when I'm going to give you all an incredible shout out, California Budget and Policy Center. So you all know, you researchers know that your work is having incredible impact. While we were sitting here, the Senate, State Senate released their blueprint for the state budget, and in it included a $5 to $8 billion assumption around the employer fair share tax credit, tax for Medi-Cal. I have a related bill, but that impetus and push to really get to the point of thinking we have a responsibility to make sure that we are not subsidizing corporations who have the ability to pay for health care for their employees while we are having Medi-Cal not be able to be fully funded, and we are kicking people off of Medi-Cal as in order to be able to make the numbers work. That came from the work that you all did, and I'm very appreciative of that. And so it has incredible power to have our researchers aligned to kind of put into our minds the ways in which we can be better. And so I'm thankful for that. And I actually think that with that output, we have a little bit of a fighting chance to think that one of the things that we need to do is raise revenue in the state of California. I will say, though, that I, being one of the biggest proponents of raising revenue and looking at our progressive or kind of regressive tax system in some instances, one of the things that we absolutely have to take accountability for is creating more cost efficiencies in the way that we administer our programs. If First Five is having to respond to 36 different funding streams, there's an administrative cost and administrative burden associated with that. That is more than we should be spending, and those dollars should be going to making sure that families have the care that they need for their children. Every dollar that we spend in healthcare, for instance, 25 cents of that is attributed to administrative burden. So we have our work to do, and I think we have to think about raising revenue as well as making sure that we're recognizing efficiencies.
I take the moderator's prerogative and ask a follow-up related to that. Some of you may have seen the New York Times did a video on Vermont's expansion of childcare, which centered a small business owner who owned a ski resort, and how childcare unlocked labor supply for him and for other small businesses. Kunal Modi earlier today spoke about how the business community, small businesses in San Francisco can be partners in this effort and see it not just as see the revenue as something which pays an ROI in terms of their business. And so you just mentioned also think showing those stakeholders, other stakeholders, that we are streamlining processes so that the expenditure changes family situation, unlocks more labor supply in the market. What are the other arguments we need to articulate to sort of broaden the tent on this sort of reform?
One is that there's a direct correlation with childcare and unlocking individuals' ability to be able to participate in the work in our economy in significant ways. I think, again, back to my mindset and where I think our legacy thinking is, that's something that we all need to get straight. I think, to your point, when we have business and corporations on board with the idea of providing childcare or providing their employees with the ability to pay for childcare directly, it also unleashes incredible economic gain for the state of California and for every individual family, and quite frankly for that business. So I think if we were able to hold those two things at center, as well as to not just think about what we do for our infants and toddlers, but also think about the ability and capacity of us to do that for our children as they go throughout our their development, then we would have a mindset shift that would be incredible, and that would yield billions of dollars in our economy in the state of California.
Well, with that inspiring closing remarks, I want to thank the Assemblywoman for joining us.
Thank you.